So first, let's locate the point. So make sure you actually have the wrist rotated, but just to make sure it's relaxed, not too tight. Sometimes patients are so nervous, they're twisting up like this. So you want to make sure they're relaxed. So relax in one way, the other relax in this way. So make sure the muscles are not in a tight or spasm condition. Then we actually try to locate a point. This is bone, and then this is where it's a meat. So that's why we actually go with this thing. And you can actually visualize this is the coccyx. So that's why you actually are trying to correspond to it. Okay. And the needle goes in like this. Okay. Now I'm doing the needle. The bone actually has an angle. So when you tap the needles in, the needle goes in. You have to feel where's the edge and side of the bone. So you follow where, just very close, intimately follow the edge of the bone. Okay. I have another one. Okay. So you tap in, then you actually have them to breathe in and breathe out. Very well. So if you find the right angle, you can go easily and smoothly. And then, should we do Dong Qi? So how do you do Dong Qi for him? Yeah, ask him to move, right? Exactly. That's a Dong Qi. Of course, you can massage too. But usually it's better for asking him to massage himself.